and we were talking about the terms that they use for webinar for breastfeeding. So predominantly breastfed basically is an infant that has been breastfed but has consumed. In other words, mom has been also providing the baby with the main source of food is breast milk. But in addition to this, the baby is taking water, fruit juice, teas, oral rehydration fluids, whatever they need outside also. They are not breastfeeding exclusively. Fully breastfed includes both predominant breastfeeding. It's like the baby is only consuming breastfeed. That's it, breast milk, not any other. And even after a couple of months, when the baby wants, the mom is only giving him or her the breastfeeding. Bottle feeding basically is the process of feeding the baby liquid or semi-liquid. This can occur. Some women also pump their breast and then give their milk via bottle feeding also. So basically those women who do that are actually predominantly breastfeeding because the baby is taking other sources of food. They're taking the breast milk, but the breast milk is not directly from the breast. It's actually from the bottle. Complementary breastfeed, baby is nourished through combination of breastfeeding mechanisms. So in addition to breastfeeding, baby is also consuming solid, semi-solid food. So basically, um, we have the notion that breast is best, and there have been a lot of studies. There have been a lot of studies on that. World Health Organization, UK Department of Health, most of them have seen that exclusive nutrition for a baby should be breastfeeding for the first 6 months. Exclusively. Most women are physically able to breastfeed, but there are exceptions. Some women do not continue it, or they start and then they stop. The reason why, because trauma has injured the breast, the milk, the hormonal glandular deficiency. Maybe they're not producing enough milk, or they don't have enough milk, or they had certain infection of the mammary glands that caused them to stop, because it's really painful when the baby is breastfeeding. Even in situations where maternal diet is poor, breastfeed will be maintained in the micronutrients. So whatever the mom eats is then consumed, is then changed into milk. So even if the mom is not taking care of herself, she's not taking care of her diet, the body is still going to make milk, basically because the baby is asking for it, and then the mom is feeding. Maternal deficiency of water-soluble vitamins can impact on milk content. So basically, if the mom is not eating a healthy diet, then the milk will have a deficiency of vitamin B1, B2, so thiamine, riboflavin. Vitamin B3 is ascorbate, B6, and B12. Maternal reserves of fat-soluble vitamins and minerals protect milk from fluctuations. So in other words, what mom eats affects on how the milk is produced. Reasons for not breastfeeding. So a lot of women do not want to breastfeed, and the reasons is culture, societal attributes, education. If they, in the beginning, nowadays we are starting to recognize the fact that breastfeeding is very important, and breastfeeding is not only beneficial for mom, but also for the baby. So in the beginning, in the early 70s, 80s, and even in 90s, and in the early 2000s, this was not something that hospitals was also, and doctors and pediatricians would also, focus on. Now you see that change. So culture, depending on the culture, you have moms who will breastfeed their kids and their babies, and then you have moms who will not. Societal attitudes, a lot of times, attitude towards the place you're living. If your education also, because if you don't know, if the mom doesn't know the benefit, she's not going to go for something that she's not aware of. Reasons for stopping is pain and difficulty techniques. Sometimes for some women it's hard to get to that point of um being able to breastfeed the baby. Influences of feeding method. So basically, it's very important in certain. It's very common in certain groups: older women, women educated beyond age 18, women from ethnic minorities, women from higher socio-economic classes. So it's more common because these women are educated. These women know the importance of breastfeeding. They know the importance of why it's important for their kids. Also, the women who belong to a higher economic class. Culture, background, social norms, all of these play a very important role. Example is Scandinavia. 98% of the women they initiated breastfeeding and 50% maintain even after 6 months. So culture where you are from also has a very big influence of how and why mom would breastfeed. Reasons for not initiating breastfeeding: women may not begin feeding due to, some women do not begin breastfeeding even after they have the baby and they have the ability, the body have the ability to make milk. Some feel embarrassed. So the second time, some women have to go back directly to work. Some wish for their partners to share the task of feeding, because then, if the dad is feeding the baby, then there's a bond that the babies have creates with the uh, with the dad too. If the mom is the only one who's doing it, the dad doesn't get that bond. So some women prefer their partners to also share that feeding with them. So a lot of time then they have to give up breastfeeding. Convenience and reduced dependency on the mother. So if the mom is not breastfeeding the baby, mom can actually get that relief that I don't have, it's not time, whenever it's time for the baby to have milk, they're gonna have less dependency on the woman. So if the mom is not there, anybody else a bit can feed the baby. And then also sometimes it's easier for the mom to see what the baby's having. Reasons for stopping breastfeeding: first of all is engorgement, then infections also are common, sore nipples. So these are three main reasons why. There are other issues like, mom doesn't have success in producing milk, so she stops. Engorgement basically means that the baby is just been taking milk, but the milk is not, for the first 3 days, the baby is just getting used to the fact of breast milk. So he or she's really not drinking any milk because milk is not being produced, it's colostrum. It coincides also a lot of times with a lot of women go through postpartum depression at that time, and that sometimes also affects their product ability to produce milk. Some women start having discomfort and they end up having sore nipples, and that also causes, because that's painful, causes the mom to stop. Some women also complain of infections like infection of the mammary glands, which is mastitis, and sometimes they can also have a fungal infection of the mammary glands, which is through Candida albicans. So these infections can be painful, and then because if you have infected nipples, you really can't breastfeed the baby, or if mom is pumping her breast, she really cannot continue doing that. So therefore, baby mom has to stop to breastfeed. Most of these issues are related to feeding techniques. They can be overcome, but it takes some time, and sometimes because breastfeeding is usually on demand. If there is no demand for breastfeeding, it will stop. Insufficient milk. Another reason for moms to stop breastfeeding. A lot of women, like I mentioned in the beginning, are not producing enough milk, and as a result, baby is not able to get the relieve the hunger, and then mom ends up getting upset. They get really discouraged, and a lot of times they stop. Other thing is stress, fatigue, because a lot of times if you're a new mom, you have other responsibilities, you will be tired. A lot of times you'll miss your diet and you'll miss your resting period, that all of these affects a mom's ability to produce milk. And as a result, sometimes insufficient milk is produced. And because of that, a lot of time moms have to stop. Promotions. So now, like I said in the beginning, breastfeeding is something that is becoming really popular and important. So now there are different ways to help a woman to continue breastfeeding. She should not feel like she's alone. Um, Basically, health professionals now, they are midwives, health visitors who will give you advice. The special charities that have been produced as a result. One is La Leche League. They help moms to overcome the embarrassment and the difficulties of breastfeeding. National Childbirth Trust is another charity. And then also, a woman is a lot successful when she notices that she has support from her family, especially the husband or the partner. Nowadays, when a woman gives birth in a hospital, she has a baby friendly environment. So one of that is worldwide program like UNICEF is working on that. It allows the mom to overcome the difficulties of breastfeeding. Coordination among the hospitals, the doctors, um, their whole environment. Also, people she sees like from the society, from family. Hospitals and maternity units have now started to achieve accreditation or certificate by implementing policies and practices that promote breastfeeding. So basically, baby-friendly hospital initiative, there is an accreditation or certification. And that shows that if a woman goes to that hospital and is linked to that hospital and goes to give birth to her baby in that hospital, she has a better chances of having successful breastfeeding and continuing in future. Advantages. So now we come to the main point of this webinar. The webinar was basically talking about advantages of breastfeeding. So what are the advantages? First of all, if a woman starts breastfeeding, she has better complex, she basically has a relationship and she has less risk of having the following diseases. Osteoporosis. Osteoporosis is a disease that happens later in life when the woman is postmenopausal, and as a result, she has low minerals in her bone, and that causes her to have more chances of having fractures as she ages. Women who have breastfed have higher bone density, mineral density. Younger women who breastfed as an infant for more than 12 months have lower bone mineral density after menopause. Menopause is when the mom's, after when the mom's changes in the mom or a woman occurs, and a lot of that is dependent if she has breastfed. If she has not breastfed, then there are chances that she will have bone mineral disease, which is an osteoporosis. There is a slight risk of breast cancer. Breastfeeding any period of time, whether it's a month or 2 months or 6 months or for full 2 years or 1 year, reduces the risk of a woman of having breast cancer by 30%. It's also shown to have a reduction in the risk of ovarian cancer. 24% risk reduction in risk of ovarian cancer in a woman who has ever breastfed. If you were a woman who breastfed for a longer time, like maybe a year or more than 6 months, then you benefit by 8 months, 8% reduction for every 5 months. So this is a big benefit for a mom. Advantages for babies. So now breastfed is not only good for mom, it's also good for baby. So in the longer run, what is it good for babies for? If it's the optimal form of nutrition for 6 months, baby has lower risk of infections. You have certain protection against certain infant death syndrome. The brain function is going to be superior. It's going to be enhanced because baby's getting the nutrients like DHA from the breast milk, which is not present in formula milk. A protection against allergies, that baby has lesser chances of having allergies, lower risk of obesity, or any other child-related disorders. Then another benefit for infants is infection, reducing infection. From developing countries where the resources are less and moms have no other choice than to resort to breastfeeding their children, babies are at a lower risk of diarrhea and respiratory infections, which is a major cause of death for a lot of kids under 5. This is explained. What is the main reason? Formula milk is not, see, the formula milk has to be mixed with water. So if the formula milk, if the water is infected or the water is unhygienic, you have more chances of mixing the formula with that water and causing infections. Human milk, another one, consists of immunoglobulins. Immunoglobulins means that these are antibiotics. Lactoferrin, T lymphocytes, and macrophages, these are all white blood cells that are naturally found in the mom, are also transported in the beginning when the baby is born to protect the baby from infections via breast milk. And that causes the baby to be protected, because right away when the baby is born, the immune system is not developed. The only way the baby will get that protection is through the mom. Benefits of for the infant, again, another one is brain development. Breastfed infants have been reported to have high scores in develop in when they are compared with developmental abilities. They are basically high scored. So even if the baby is a preterm infant or a full-term infant, but if the baby was breastfed, you can see the change. The baby's development in the brain will be um, enhanced compared to a baby who was born full term and was never breastfed. Then there's an improvement in IQ, because again, moms who are educated, have more knowledge about the benefits of breastfeeding, have more chances of breastfeeding their kids. So then you see that the baby's IQ is also increased. And then social and behavioral um, changes and improvements are also found in the baby. Then again, like I mentioned in the beginning, breastfeeding milk or breast milk has long chain fatty acids that are not found in formula milk. They have now been added in formula milk because the importance of these long chain fatty acid in the development of the baby's brain and body has been found. So these are arachidonic acid and docosahexaenic acid, which is DHA. DHA and double A or AA presents high amount in human milk, and the purpose again is to develop the brain, to have brain development of a baby. And these are basically found in large amount in human milk. While in formula milk, you have precursors, meaning they are not they're not found in an active amount. They're not found in an active form, but they're found as a precursor, like a non-active. Example is linoleic acid or linoleic acid, which are basically precursors of vegetable oil. So basically, in order to overcome those amount of DHA and AA, some formula also derive DHA from eggs, because eggs have 0.2% of these fatty acids. Human milk has 0.4%, which is enough for a baby to have in order to have their growth and development. So summary, in short, since we're running out of time, and I apologize in the beginning, I was having some difficulty recording the webinar. I really would like to record it and put it on our YouTube channel, on our Facebook, on our Twitter account. So if you have association with, if you are on social media and you have a Facebook and a Twitter account, and if you are a regular person who watches YouTube, please do go on our channel and you can see these webinars. I will be putting them in a few minutes after we're done with the webinar. In the beginning, that's the reason why you saw me look like I'm very, very lost and trying to figure out what is going on. I apologize for that. So World Health Organization has recommended that babies should be, which is, it's not perfect in every situation. Every situation is different. Should be breastfed for 6 months. Um, Basically, the issues that are cultural issues, the main thing is how to initiate breastfeeding. Nowadays, basically, this is something that women have to go through once they deliver the baby, and they are then it's initiated while they're in the hospital, in order to show the mom that, okay, this is how breastfeeding needs to be done. The Baby Friendly Hospital Initiative is a program that promotes breastfeeding. And then breastfeeding is something that we all, as a nutrition and an wellness expert, should also focus on. If we are dealing with clients that are pregnant and we're looking after their diet and we are giving them diet plans because they've either gained too much weight, or they're trying to stay healthy for the baby, then this is something we need to focus on too. We need to show them, or we need to explain to them the importance of breastfeeding once they give birth to the baby. I hope you liked the webinar. This webinar was actually taken from the Nutritional Science program from SIAHT, which is a nutrition wellness coach program. The program will teach you how to give educated nutritional guidance and nutritional coaching to individuals seeking nutritional advice on weight management and enhancing health and fitness performance overall lifestyle. You as a student will learn fundamental skills of counseling strategies, protocols. You will actually have case studies that you will be given in order to make sure that you are able to coach that patient or that client, and then design a diet plan. So the program is 40 weeks. It's all online. So if you are one of the students who are one of those interested individuals who are looking to get an education whilst working, our institution is best for you. We teach you, in the first term, you learn about anatomy, physiology, and principles of nutritional sciences. The second term, you learn about nutrition, health, and disease, and nutritional assessment. The third term, you learn about nutrition, health, and disease, part 2, and community nutrition. And then the last term is capstone, which is actually a writing project. In other words, you get case studies in here. In this, you do a lot of research, and you have to then design a plan, a nutrition plan for these clients. Once you complete the program with SIAHT, you can then sit for the Certified Nutrition Wellness Coach exam with National Association for Fitness Training. The classes will be starting on April 17th. You can go on our website www.siaht.org, and you can register to receive a free tablet. We are one of those institutions that are totally online. We will make sure, if you have any questions, if you have anything that any confusion regarding your program, please do contact us, and you will be able to see that we help you and we coach you. So once you start with us, we will make sure that you go through the program to the full 40 weeks, and also are able to complete and register for the program. So and graduate from the program. The program again are starting April 17th, and when you register on SIAHT.org, you can receive a free tablet. Once you pay the registration fee, once you are registered, you get a confirmation from us from our academic department saying that, okay, you registered now, you can go ahead and pay the registration fee. Then we order your free tablet, and then you will have them when once your classes start. We are also on Facebook. We are on Twitter. And we have a YouTube channel. So if you are looking if you are one of those individuals who are on social media, please do take a look at our accounts. Like us on Facebook, follow us on Twitter, follow us on Instagram, follow us on LinkedIn. We are also on LinkedIn, and we have a YouTube channel. You will be able to find this webinar, a recorded webinar, on the YouTube channel. Thank you, and I really hope you took away some information of importance of breastfeeding from us. We will be also conducting more webinars, so please be on the lookout. If you like us on Facebook, you will then be able to keep up with the updates for our programs. Thank you.